osteoporosis, it is a diffuse metabolic bone disease which is affecting all the bones in our body. And in this kind of disease, what happens is the formation of this calcium deposition and crystal formation of hydroxyapatite in the bones, it is impaired, which leads to weak bones, which are very prone to fracture, especially on minor insult, like for example tripping over stairs, or just any minor trauma that can lead to fracture of your bones. So in osteoporosis, the main bones which we are looking at is the spine and the femurs and the forearms. Why these bones? Because spine and femur, they are the most weight, most of the body weight is supported through that. So that is usually considered to be more reflective of the generalized bone mineral density. So in osteoporosis, there is actually a decrease in the bone mineral density. So what is bone mineral density? The mineral content in the bone. So that is actually reduced. And it is a metabolic disease, and it affects all the bones in your body. It is a natural process in females when their estrogen hormones, or when they come towards menopause. Then what happens is that there is a sudden decline in estrogen. Estrogen is a hormone which is required for bone health in females. So it is commonly seen in postmenopausal females, and that is termed to be, although there are multiple causes, but most of the causes are because of this postmenopausal status. And other causes are like in pregnancy and lactation. Some patients, they develop osteoporosis, which is known as pregnancy and lactation associated osteoporosis, and other systemic disorders are there. For example, diabetes mellitus. So diabetes is a different kind of bone affection is there, in which the bone quality is more affected, although the bone mineral density is increased, but the bone architecture is affected. So diabetes, pregnancy and lactation, postmenopausal, then other disorders like lactose intolerance, celiac disease. These are the common causes. And one important cause to mention in females is breast cancer. So any breast cancer, any hematological cancers, for example, multiple myeloma, these are also the causes of osteoporosis. And we should also keep in mind that drugs, especially heavy metals, etc., they can get deposited in your bone, and they can make them weak. So drugs, particularly contamination with heavy metals, that can also lead to osteoporosis. Most of the patients, they will be either asymptomatic, or they will have diffuse body aches and body pains. Like they will say that my hands are always paining, my legs, my shoulders are paining. They might have fracture also, so they may have reduced height. Some females, especially postmenopausal females, they may have a stoop posture, reduced height, and mostly it is a generalized pain, generalized weakness. That is a commonest presenting symptom for this osteoporosis. However, a number of patients, they are totally asymptomatic, and it is only when they have a fall and they have a fracture, then this thing comes into notice. So most of the symptoms are actually vague. Specific symptoms are like bone tenderness is there on palpation. So, for example, they may have spinal tenderness, or tenderness around the ribs. So that could be because of osteoporosis. So it is a deep, boring, dull, aching kind of a pain. However, if they develop a fracture, then it will be very sharp, very severe pain, and it can also lead to compression of one of the nerves in your body. So you may have weakness in your leg or foot. You may have tingling, numbness, pin and needles in one of the legs. You may have an electric shock-like sensation also going towards your leg from your spine. So that could be the manifestations of osteoporosis if it is leading to fractures. So regarding avoidance, so there are a list of drugs which can cause osteoporosis, so that you should avoid. And second is other things that you should, smoking and alcohol. They are also quite a significant cause of osteoporosis, so they should be avoided. And other thing is that I forgot to mention about rheumatoid arthritis. So connective tissue disorders like SLE, rheumatoid arthritis, they are also an important cause of osteoporosis. In fact, many patients with rheumatoid arthritis, they have osteoporosis. And one important cause in drugs is steroids. So many of the patients are receiving steroids for their conditions like chronic obstructive airway disease, or rheumatoid arthritis or other connective tissue disorders. So steroids are a major, cause for osteoporosis, especially given in transplant patients and those patients who are on long-term duration of steroid use and dose of steroid that also matters. So smoking, alcohol, these have to be avoided. There is a huge list of drugs which have to be avoided if you are on steroids, and you need to consult with your treating doctor about how can they screen you for osteoporosis and how can they prevent you from having fractures. So this is in general. Otherwise, for osteoporosis, they should have a high calcium diet, and vitamin D supplementation should be there. Levels should be optimized. Muscle strengthening is very, very important. So strength training as well as other kind of training, that isometric exercises and other band exercises, they are also very, very important. Spine movements. So these are the factors which can, prevent osteoporosis, prevent you from having fractures. They may not completely avert the process of osteoporosis. Onset is usually insidious. However, some patients, like I told you, that most of the patients, they are having generalized vague body aches, body pains, right? And often they are giving multiple multivitamin supplements, but they're not responding. So most of the patients are usually asymptomatic. However, some patients, they present directly with a fracture. For example, just a tripping in the bathroom at night while the lights were off or while there was darkness, they directly come with fractures. So in that case, the pain may be very severe. Some patients may be having a limping gait, stoop posture, and they will not be able to bear the weight on the legs. So these are the usual presentations of osteoporosis. One important hormonal cause for osteoporosis is hyperparathyroidism. So we have a hormone in our body which is called as parathormone, which regulates the calcium homeostasis in the body, and also has an important role in maintaining the bone strength and bone quality. So some patients may have a nodule formation in the parathyroid glands, which may lead to high calcium and osteoporosis. Similarly, high dose of thyroxine. So patients who are known case of hypothyroidism and who have been prescribed high doses of thyroxine, so that can also lead to osteoporosis. So I think this is another important cause, hypothyroidism on treatment, so that we also have to look for while we are evaluating a patient for osteoporosis. Management begins with lifestyle modification, proper strength training, isometric and resistant exercises, adequate calcium and vitamin D supplementation in the diet. So these are the basics: avoidance of smoking, avoidance of alcohol intake, right? Adopting a healthy lifestyle, and also they need to look at the other factors which can cause osteoporosis. So like the list of diseases I gave you, so they have to be screened for those diseases if they are having osteoporosis or symptoms suggestive of osteoporosis. So otherwise, regarding drug-based treatment, so we have multiple injections which are available. Basically, I am talking about post-menopausal osteoporosis, so which is the commonest form. So in that, we can give some hormone injections, like we give parathormone injections, which are given for a period of 2 years, followed by other agents like we give zoledronic acid, denosumab. So we have a variety of drugs, and nowadays we are preferring these molecules over the previously existing oral tablets of alendronate or ibandronate. So these are not used nowadays. We are using more advanced methods which are more effective for increasing bone mineral density. So again, so for rheumatoid arthritis, first is your disease should be well controlled. If it is an uncontrolled disease, your bones are going to be affected. Second, nowadays many doctors, they are using non-steroid sparing agents for treatment. So you should discuss with your doctor whether it is possible for you to discontinue steroid and switch over to another biological agent which are safe for bones. Third thing is that apart from the general measures like physical activity, diet, high calcium intake, vitamin D supplementation, exercise. Other thing regarding rheumatoid arthritis is that there are other associations also. For example, they may have anemia. So anemia may impair your wound healing, and it may also affect your bone growth. So disease activity has to be properly controlled. Drug has to be discussed with your treating doctor whether you can avoid steroids, and physical activity and lifestyle, especially special care to avoid alcohol and smoking. I think these are the prospects. And for those patients who are already on steroids or who are having rheumatoid arthritis, there's a screening protocol is there. So I think they should discuss with the endocrinologist how we can screen them for early detection and treatment of osteoporosis. There are a list of secondary causes which I have told you. So if a patient is suffering from these disorders, then they should get their bone mineral density after consultation with their endocrinologist. Number one. Second thing is regarding prevention. So adequate calcium and vitamin D supplementation is most important, and muscle strengthening. So we have to prevent something called as sarcopenia. So if your muscle strength is good, your bone strength will be good. You will be able to prevent any kind of fractures from osteoporosis. So that is important. That is something which is in our hands. Other things like genetic factors are there. So for example, if there is a family history of osteoporosis, and there are certain genes which are causing bone density is decreased if they are carriers of certain genes. So yes, a part is in our hands, but most important is your lifestyle modification, calcium, vitamin D, and physical activity, as I just told you.